There's a lag time.
Okay, are we live?
Yes. Hello, everybody. Good evening. It is 5:30, and hopefully you are here to learn all about male hormone optimization. Last week, we spoke about all things for female hormones, and so this is going to be a really great transition to talking about all things males for all of our fabulous male patients and males out there that just want to learn a little bit more about male hormones. So let's get into it. Erin, are you ready?
I am ready and excited.
Okay, so today or this evening, what we're going to talk about is we're going to do a deep dive into understanding male hormones. How does this affect our body, and how does this affect our body when our testosterone levels are dropping and when they're really low? We're going to review some of the risks and the side effects, but we're also going to go over the many benefits of utilizing hormone replacement therapy. We're going to go over exploring the evaluation process, what treatment options are there, and sort of how do you get started when you're thinking about seeking care out. And then we're going to address some of the common questions that are frequently brought up when we talk about hormones.
So, why male hormones matter in your health? We want to make sure that we're having our optimal performance and our brains are functioning as well as they can. We want to make sure that we're balancing all of our hormones to help multiple body systems, which we're going to talk about later, and about our overall well-being. In this slide, you can see or in this chart, you can see when we are 20, our hormone levels are really, really high, and those gradually decline over the next 2 decades, but they sort of rapidly drop when you hit 50. You can see that big chart. And I think the numbers are after the age of 30, we're really going to see a 1 to 2% decline in men's testosterone levels.
Yeah.
There's a lot going on in this chart, but what this really shows where when you have decreasing hormone levels, which is on the left-hand side of the screen, you can see that we have these other risks for different comorbidities, such as type 2 diabetes, fatigue, coronary heart disease. And if you notice when our levels get really low, that's sort of like that sexual dysfunction is really happening at those really lower levels. But when we think about testosterone, that's the first thing that comes to mind. Well, my sex life is fine. But you will learn in this that that's really the last thing that happens, and there's all these other symptoms that happen before that.
Exactly. So let's get into just understanding a little bit more about the predominant male hormones and what they do. So, of course, testosterone is the biggest one. It is a male's primary sex hormone. It helps to build muscle, maintain bone density. It certainly affects our energy and our mood, but it's also important for our libido and sexual health, reproduction, of course, and then creating and making red blood cells in our bone marrow. And then next to that, you have luteinizing hormone. And luteinizing hormone, think of this as sort of like your on switch to turning on your testosterone. So this is produced, or it's sent from our anterior pituitary gland, and it's stimulating these little cells in the testicles to produce testosterone. So it's really important. And then there is something called follicular stimulating hormone. And this is really what controls sperm production. So when we're checking hormone levels, we want to sort of check all of those pieces, because we might, depending upon what the luteinizing hormone is, we might be able to use other agents, which we're going to talk about, to sort of stimulate a man's brain to do that work rather than giving someone testosterone to take over that. While it's not on here, estradiol is also really important for men. I know that we all think that men are the only ones that have, or excuse me, that women are the only ones that have estrogen, but they don't. Men also have estradiol. And this is when a man is creating testosterone, and this is the same for men and women, when testosterone is created, some of that testosterone is converted into estrogen. And estrogen is beneficial for men as well because it protects men against cardiovascular disease, and also helps, it also affects mood as well, and lots of other things like bone health. But that is an important hormone. And then checking cortisol levels, because of course that's, helping and affecting our metabolism. And then thyroid hormones as well, because that is definitely regulating metabolism. And that can certainly have an effect, that whole endocrine system. If one of these areas is out of whack, then all of these other things can be affected. So it's important to sort of take a global look at all of the hormones that are affecting men.
So here are some symptoms of low testosterone. And we can see that you may have some metabolic dysfunction, some decreased insulin sensitivity, leading to some increased body fat and weight gain. Likewise, you may have, affecting your musculoskeletal system, some decreased muscle mass. You might see reduced strength. You might lose some bone density, have some joint pain.
And then neurological. So, it's very common that men might feel that they have brain fog. They're not concentrating very well. They can have some memory recall, and they just don't feel like they are as sharp as they used to be. So that is, that's a big one.
Yeah, hematologically, so our blood, what happens, it can actually decrease. So when you have low testosterone, you could have decreased red blood cell formation. And remember, oxygen is carried by red blood cells. So so you could have some reduced oxygen transport. You could have some anemia.
And then, cardiovascularly, when testosterone levels are low, it could potentially put men at a higher risk of atherosclerosis, or hardening of those arteries. It's common that men will start to see higher levels or their cholesterol panels are starting to elevate, and or they all of a sudden now are developing high blood pressure as a result of testosterone levels being low.
Psychologically, I hear this a lot. I don't have
Yes.
any motivation to go to the gym. I'm sad. I'm very anxious. I've never been anxious, or maybe noticing some really significant mood swings. That's just not you. This could all be related to some lower testosterone levels.
Yeah, and I always think that that's important too, because I think in general, when people are maybe seeking out care, or maybe they are feeling a little bit more anxious or depressed, and then we're put on other medications like SSRIs or antidepressants, when we really just needed to figure out why this is happening initially, because even those medications, which Aaron are going to talk about, can sort of lead to lower levels of testosterone. And then sexual and reproductive system. Of course, low testosterone levels are going to lead to reduced libido, low sperm counts, issues with infertility, as well as erectile dysfunction when levels start to decline, when they're really low. And then last but not least,
sorry, I skipped.
She skipped ahead. She's ahead of me. Okay, Aaron.
So why do we have hormonal imbalance? So naturally, the majority of people, if you have low testosterone, the majority of men, it's going to be related to the natural aging process. You're getting older, less hormone, less call from your brain to your testicles, or maybe your testicles aren't just functioning, right? But there are some other things, some genetic factors might play into this, or perhaps if you're young and you have low testosterone, perhaps there's maybe something in your brain, like a little bit of a a tumor or a prolactinoma that can cause some low testosterone. But there's other medications that might disrupt hormonal imbalance. And we're really like kind of looking for those like root causes. But maybe it's just a poor diet, lack of exercise, you're very stressed, you're not sleeping. These can also contribute to low testosterone. And I think lastly, looking at environment such as like pesticides, plastics, or maybe you work in a chemical plant and it might be chemicals. I think that's kind of like on that other side of what we might look at.
Yeah.
But these are all some things that can cause some hormonal imbalance.
And I think in general, when you think about just our lifestyles in general, I mean, it's not like our life isn't what it used to be in the early 1900s, right? I mean, we have very stressful jobs. We are spending lots of time in the car. We are carting our kids around to a million different things. And life is just sort of not for, sometimes it's not necessarily about us. So it's sort of common that, or I think when we start thinking about hormones in general, it's a common occurrence because there's a lot of factors that are playing into this. So what is hormone replacement therapy? Hormone replacement therapy is essentially we are just providing hormones back that your body is deficient in or that you've become deplete in. And there are many different forms which we're going to talk about, but it's really when it's falling below those reference ranges. And it's not necessarily the reference range that your insurance company wants to see, such as a testosterone level below, Erin, is it 200, 300,
I think it's 270.
270? So, I mean, that's drastically low. But as we'll talk about, is that oftentimes we're never measuring a man's testosterone level when they're at their peak. We're never measuring that when a man is in their early 20s, where levels are here. And go,
Can
yeah,
I just
go.
speak to that? Although, if you are feeling erectile dysfunction or fatigue, or maybe you've never been able to build muscle mass, we might uncover
Yeah.
something for you and think outside the box, because even if you're in your 20s, there might be an underlying root cause
Right.
of those low testosterone levels.
100%.
However, I would say that the majority of men are going to be in that like middle age number.
Yeah. Yeah, I agree. I agree for sure. And then the benefits of hormone therapy. So, as you can imagine, if we just went through all of those symptoms that a man might be feeling, and so when you're repleting that back in the body, of course, you're going to have these benefits of the physical benefits. So, a man is likely going to be able to increase their muscle mass as a result of just restoring this. If they're trying to lose weight, testosterone isn't going to make someone lose weight. But if you're putting in all of those efforts and you're going to the gym and doing those things, well, then your body composition is going to change. It's going to increase energy levels, better sexual function, improved focus and clarity, reduction in anxiety, which is a huge one, and overall motivation. And then, of course, those wellness pieces, better sleep quality, reduced fatigue, and overall recovery. A lot of times people will say, I'm going to the gym and I'm working out, but man, it's taking my body like 2 days to recover from that exercise. Well, that's going to help with that. And just that overall vitality. And then I put this picture here because I thought
I love this picture.
yeah,
Dan.
and
really
it is
do.
important because I think a lot of men think of whenever you say hormone replacement therapy, there is a negative connotation with hormones. And it's because we think of, oh my gosh, hormones are only for a bodybuilder. And that's not true. Hormone replacement therapy is for everyone on the spectrum. Yeah, there's going to be, people that are very fit and that want to use this. And yeah, they might be really muscular, maybe, but it's also for the spectrum of your day-to-day wonderful man out there that just wants to feel better. And so I think it's important to sort of squash that thought of that there's just this one persona of who uses hormones. Hormones are for everybody and it's for every man.
So I think it's always important to talk about the side effects, obviously, and some risks that can be associated with this. So the most common side effects, people can complain of acne, mild fluid retention, maybe some temporary like emotionality or mood changes. And then if you're doing injections, some people get some soreness at the injection site, usually very mild, resolves on their own. Um,
And why would someone, in terms of those common side effects, like for fluid retention or
I think that a lot of
mood
times,
changes?
Jen, we're seeing some increased estradiol, or their estrogen levels are going up. I think with acne and like oily skin,
Just
I think
those,
those like you're having like really high levels. So I think the big point when we manage side effects is really checking labs when you're not feeling good or having side effects, to make sure that we're in our optimal
yeah,
point, like where we're supposed to be
yeah.
in
And I
treatment.
think really then guiding like allow those I mean pretty minimal side effects though to also help us be a guide, and that those doses very well might need to be adjusted because we don't want those side effects to happen.
I think in terms of like things that can affect your health, we really want to watch that red blood cell count so that you don't get like heme concentration. Um,
Putting
and
people at risk of
I think, I think,
clot.
I think we could have uh, theoretically an
Yeah.
increased risk for blood clot with that.
But if you're following those and those levels are normal, then that should be sort of,
Minimized.
yeah.
I also think, and this is again a very less likely side effect, but testicular shrinkage. Um, for sure, if you're like worried, if you're planning on having children in the future, infertility can
Yeah.
happen if we're using exogenous testosterone, but there are other options. Another thing that's not on here, but if your estrogen goes too high, you might get some gynecomastia or like some increased breast tissue, and certainly men typically don't want that. And then lastly, here we have, if you have untreated sleep apnea, this can get significantly worse with testosterone therapy. So it's really important to treat your sleep apnea, not only so you can go on testosterone therapy, but for the other health concerns related to sleep apnea.
For sure.
So last part here, we really want to be conservative in our dosing to get you into that therapeutic range. We want to regularly monitor your labs, give you other therapies that might optimize your health, and have this like sort of very personalized therapeutic approach that we try to provide here, so that you are reaching your maximal.
Yeah. Yeah. The benefits of utilizing hormone replacement therapy. So I just wanted to put this in here because Aaron and I, listen, we are nerds at heart, and research and evidence-based research is really important because evidence guides our practice in medicine. And this was a huge study. It's called the Traverse trial, and it was updated, and this looked at over 5,200 men age 45 to 8, I think it was 80, and they followed men over a nearly 2-year period. And what they were really looking is that they were really wanting to identify cardiovascular risks during that time. So they wanted to see, are men on hormone replacement therapy at a higher risk of developing cardiovascular risks? And what they found after that 2-year period is that there was the same risk in both in the placebo group, meaning no hormone replacement therapy, and the group that had hormones. It was a 7% across the board, which I think is a really, I mean, that's, first of all, that's a huge trial. That's so many patients. And that's just one of those things that I think that we can sort of sit back and say, hormone replacement therapy can be very safe in men when we are making sure that we are checking labs, that we're making sure that those levels are not going high, because we don't want people having high hemoglobins, putting them at potentially putting them at risks, and making sure blood pressure is okay, different things across the board. If you're being well cared for, you should really hopefully be just getting the benefits of this therapy and not getting all of the risks of the therapy. Erin, anything else that you
No, I think the big thing is in the past, people have generalized that if you take testosterone, you can have a heart attack. And this is really a study that shows it's as safe as
yeah.
not taking it.
And we'll talk about that, but I also think that's the type of testosterone therapy that one is taking. There are older oral versions on the market that, had increased risk of liver disease and lots of different things, and lots of sort of anabolic or sort of like off market steroids that are not good. And so and we're going to talk about different types. But first, before we go into that, what is it going to look like if you come into the Alchemy Clinic for therapy? So first, it's really symptom recognition. More often than not, men are coming into the office because they're starting to feel something. They're feeling something, they're seeking care out. And at that point, it's really important. We want people to fill out some questionnaires to sort of get a sense on what are you feeling? Because when someone then gets treated, you want to then go back and see, oh my gosh, look at all of these things that improved, and have something objective to know, was there a benefit versus not. Then there's that initial screening and consultation, which is important. And that clinical consultation that includes, we want to go through all of the factors and have it be a holistic thing. We can't have blinders on thinking that this is only, these symptoms are only related to hormones. No, it could be related to gut health, or maybe men are having difficulty with, weight or metabolic issues that we need to address prior to or in conjunction with doing hormone replacement therapy. And then, of course, lab tests. And it's not just hormone labs. Well, that's going to be included in there. It's ensuring that things like vitamin D are optimized. What does cholesterol panels look like? What are all of those labs that we need inflammatory markers that we need to make sure that we're looking at, so that we can really ensure that that our patients are optimized and they're feeling really good. Because men can get, you can get hormone replacement therapy, you can get it, but that doesn't mean it's going to be done well, and it's going to be done for you. And so I think that that's the biggest thing, is just making sure that all of those pieces are taken care of. Anything else, Erin?
No. Okay. Let's talk about the different types
of hormones. So oral therapy. There are now some newer oral testosterone options. We have not utilized these a lot. The older oral versions had a lot of side effects, and they were just not great. They had higher risk of elevated liver enzymes, high blood pressure, or uncontrolled high blood pressure. Oral, though, in some patients could be an option. There's the inconvenience factor in some of these newer agents. You have to take it twice a day, but it could be an option for sure. And then the other oral option that we wanted to talk about is something called enclomiphene. And essentially, this is an estrogen blocker, but it is used for those maybe younger patients who have lower levels than we would like of testosterone, but we're trying to protect their fertility. And this essentially is just stimulating that gland in your brain to stimulate your testes to produce testosterone. So that can be a really safe option. Men can be on that for some time, and then eventually they might need to then transition to exogenous testosterone, but that's an option. And then transdermal, we do have several men that are on a transdermal form, or a gel form. And this can be beneficial. We have several men in clinic that their levels actually were surprisingly, they had good response to utilizing a gel formation. The only thing is just the increased risk of transference. So if remember, men have 10 times more testosterone than a female. So if a man is using a gel, they just have to be careful about when you're putting that on, you want to put it on in an area that is going to be sort of, you don't have a lot of sun exposure, and you just don't want to have exposure to other people. So your spouse, your partner, your dog, your child, that's the only risk is when you're using gel.
Injectable form, I think this is the most common usage that men think of when they're doing testosterone replacement therapy. And it's very effective. I actually don't really recommend any one delivery method over the other. It's just a conversation. I really like injectable testosterone for men. I think it's a little bit harder to dial in on the exact dose at first.
Right.
And making sure your levels aren't going sky high, making sure that you're not aromatizing or making more estrogen and treating that if you are, and making sure and like monitoring your red blood cells, because testosterone cypionate, or the injectable form of testosterone, can have a higher level of both aromatization and erythrocytosis. I like to dose it bi-weekly, so you're not having quite as many like highs and lows. But we can also do weekly if that works better for the patient. And lastly, here at the Alchemy Clinic, we use bioidentical hormone testosterone in the pellet form, which is a small procedure where you get a small
They look like little chiclets. They're little tiny pellets.
They look like little rabbit food, I say. And it gets inserted underneath your skin in a fatty area, sometimes the buttocks, sometimes kind of like the love handle. And it can have a little bit of, discomfort at first because we're putting in a lot of pellets there, right? You might need,
10, 12.
10 or 12 pellets. And I think the big point with pellet therapy, and it does, if you Google it online, a lot of people don't want to do pellets because of the procedure and because of it can have a rapid drop off if we're not repelleting soon enough. So again, the point of this is checking levels, not only your peak levels, but also those low levels, to know like, when are we ready to pellet?
Yeah.
Is it too soon, or is it too far
and I always tell patients, they're gonna know. Patients that are pelleted, when your levels are dropping off. And so it's just great to, yes, we want to sort of see that peak, to sort of see like, how high did you really get? But then also, where are you dropping off, to ensure that we're not going to repellet you too soon? Or do we have to maybe push that out and then guide that therapy that way?
And I really want to reiterate, we have men here that are on
all different
and have all successfully gotten their hormones stabilized. And really, this is a relationship between provider, so Jenna or I or both, and the patient, and having that relationship to know we can change these up if you're not happy. Say you get pellets, you don't love them.
Yeah.
Great. Let's try injectables. You don't love injectables. Great. Here's transdermal.
The one thing about a pellet, though, the big benefit of a pellet is that it's sort of like set it and forget it. And for men, you're going to put that in, and for a lot of men, I mean, it's going to last about 5 months or so. So
sometimes longer. Sometimes men get 6. I've had one guy have 7 months longevity with it. So a very active guy too.
So, again, there's those risks and benefits to everything with injectable. If you're injecting once or twice a week, I mean, sometimes, it's just guiding that. But as Erin said, knowing that you can change, nothing is forever. So if you don't like one, we can try another and then go back a million times. Well, maybe not a million.
So when do we check labs? And this is really all a little bit therapy focused. So we might check labs a little bit differently when we do pellets than we do injectables or transdermals. So when I am monitoring someone's injectable levels, I really monitor it pretty closely in the very beginning until we're on a stable dose for a stable amount of time. So I'm looking at initially in the first month checking blood work, and then again every 3 months after that. And we're not just looking at testosterone. We're looking at testosterone, we're looking at your hemoglobin, we're looking at your estradiol and your prostate, as well as liver function tests. And this is really important to remember. When things get off, we're going to change up therapy. We might
Yeah.
decrease a dose. We might suggest something else. In terms of pelleting, it's a little bit different. I talked about like the peak and the trough, and then we're really rechecking these at an incremental level. Like I would say once you're stable every 6 to 12 months. So every 6 months we're checking those labs.
Yeah.
If something's off, we might check before.
Yeah.
And then I don't know about you, Jen. I have males and females that love having their levels checked, and they love having that data, and we're happy to do that.
Yeah, and that's fine. We can send it out, we can do it in office. And and then the other piece of that is that sometimes, I'm a little bit shocked that there are patients, and a lot of our men in particular, that they're not as well cared for as they should be in our community. And we've had patients that have come in and it's like, oh, I don't know, I haven't had my levels checked in a year, or and it's sort of shocking. So I just think that we want our patients to be proactive in their care as well, because it's your health too. And so we only want the best for you. And that is, that takes some guidance and just monitoring to ensure.
I want to bring up one quick thing I just thought about with monitoring levels. A big question I get with monitoring levels. Well, where should my level be? And I think it varies for every man on how you're feeling. Ideally, if you're looking at total testosterone, ideally we're looking above 800, below 1200. And for free testosterone, which
that's important
conversation.
That is important. You should just talk about that for a second, because I forgot to bring that up about hormones, but that's a vital piece of this conversation.
So testosterone can get really bound up, not only in our albumin, but it can bind
which is a protein in our body.
And it can also bind to what's called sex hormone binding globulin. And I like to say, once all those receptors on that globulin are filled up, sort of what you have left is that free testosterone. So really,
which is your usable
testosterone, right? Exactly. And so really, that is the number that I go by. If your testosterone is 1400, but your free testosterone is only 10
or 11,
that is all bound up. It's all bound up on your albumin. It's all bound up on your sex hormone binding globulin. So then we need to work on that sex hormone binding globulin, and really it's lifestyle and nutrition that's going to help improve that.
And then there are some nutraceuticals that we can help in terms of sort of flushing that out, but that is a vital piece. So it's having both of those numbers, because sometimes people are like, oh, my testosterone is fine because it's 700 and the doctor said it's fine.
I feel terrible.
And they never checked their free testosterone. And because those levels are not quote unquote low enough to be covered by insurance, then they're not treated. And so, that's, which is unfortunate. So, but those are two big pieces that we will monitor in the office. So let's jump into some frequently asked questions. And actually before, you want to start with this one? Because I wanted to bring up one other piece is PSA. And maybe that's a frequently asked question. If I've had your prostate antigens that are checked probably regularly at your physicals, we want to make sure that those prostate levels are within a normal range, because what can happen is prostate cancer can sort of be dormant, and it can be dormant for a while, and it's pretty slow growing. And most men are actually, there's a lot of men that are going to, could potentially get prostate cancer, but the chances of sort of succumbing to that are low because it is so slow growing. However, and you have to sort of think about that. The chances of prostate levels are, potentially go up. but testosterone levels are going way down. And what feeds that prostate is testosterone. And so if somebody maybe has some abnormal prostate cells, and if we then give testosterone, there is a chance that those abnormal cells could then start multiplying because they now have an environment to do so. So it's important to check those levels and to make sure that we're following and monitoring those levels. If a patient comes in and their PSA levels are already elevated, we will likely send a patient to urology first to be cleared from urology. Maybe they might do a biopsy, they might need to do some further studies, but just to ensure that we are not only checking hormone levels, but we're checking those antigen levels as well to keep you safe.
Okay, I think we already covered this, but how do you know if you have low testosterone? Symptoms, blood work.
Yeah. What age should men consider hormone evaluation? There's really no age. I mean, we have patients in the office that are coming in for evaluations at their later 20s because they really just actually want to. It's not necessarily, it's more for optimization and longevity and sort of all of these like micro benefits along the way. But I wouldn't say there's a specific age. I think most men are sort of starting to think about this in their 40s, 50s, and so on.
How long before I notice results from hormone therapy? So you're really going to notice some improvement in your mood, how you might be sleeping, in the first several weeks of starting, and then followed by like maybe a couple months, you're going to have more motivation. You're going to have like start seeing like your recovery time is better. And I really think by 6 months, like you're going to see like that sexual drive, erectile dysfunction may improve. But within the first couple weeks, you're going to feel better.
Yeah.
You're going to feel like a surge of energy. You're going to feel like your sleep is better. Your mood is better.
Oh my God. There's one patient in particular, and I just remember him walking in the door, and this was maybe 3 weeks after he started. And honestly, it was like a new person walking in the door. And I just, I think as a provider, it's just something that you're like, wow, okay, this is what we're doing is you're doing something really well for people when you're really truly like changing their quality of life. And that's hugely, we just love what we do. But anyway, will hormone therapy affect my fertility? It can, and that's what we were talking about before. That's definitely a conversation that we will be having with you if you are younger and you haven't quite started a family. That there might be agents that we would give to you to either stimulate your own brain to stimulate that process, and or just keeping you on medications when you're on testosterone therapy to ensure that we're protecting that.
Is testosterone therapy covered by insurance? So we briefly talked about that. So you have to have 2 morning testosterones that are less than 270 for insurance to cover.
Yeah.
And honestly, we're happy to try to get that pre-authorization for you if you're in that area. And then it's really dependent on what type of delivery method we're able to get covered.
Right. But there are options that are, that are relatively, cost effective, or, that like certain gels and over the counter things. So I think that there's an option for everybody. How often will I need injections? We already talked about that. Everyone's going to be a little bit different. For men, it's going to be anywhere from 1 injection a week to 2 injections a week. Most men in our practice are on 2 injections just because you feel like you're on less of a roller coaster that way. But people might they might feel just fine on 1 injection. So again, I think it's just going to be, what's best for you and how you're feeling. And we could trial that during your course.
Can lifestyle changes improve my hormone levels naturally? I think that we talked a little bit about that sex hormone binding globulin, right? I think that if you're exercising regularly, if you are sedentary and you change your diet to be like a clean diet and you exercise regularly, you're getting better sleep.
You're limiting alcohol consumption. This is a big one. That
Yep.
is a big one.
Yep. I think that,
You're creating that environment
yeah, potentially,
potentially.
if you're still making luteinizing hormone,
Yeah.
and you're still, and if your testicles are still functioning, yeah, that can happen. And certainly, a healthy lifestyle can change that.
Yep, for sure. What happens if I stop taking hormone replacement therapy? This actually is a very common question. And uh, you're just going to go back to where your lowest point was. So if your level was a total testosterone of 200 and you were on therapy and you're like, you know what, I don't want to do this anymore. It's just going to be this gradual decline, and then all of a sudden you're going to sort of go back. Your factory might still produce something, it might still sort of like pick up again, but it's you're not going to get higher than that. And if time has gone, maybe you've been on this for a decade and then you stopped and your level was 400 and now it's a decade later, well then yeah, your level might be a little bit lower because now we're a decade in from starting therapy, but it's not, your levels are just going to downtrend as they naturally would.
Are there alternatives to testosterone replacement? And we talked a little bit about enclomiphene.
Yep.
So if you are in the right patient population, and you still have higher luteinizing hormone, I think that enclomiphene is a great
Yeah.
option, especially if you're trying to preserve fertility. But we can always try. Some men are resistant to starting testosterone. But what I tell people, like, especially if you're in like middle age, 50 and above, like,
Mm.
you're like, you're just not going to produce the same
It's sort
amount
of like a woman being menopausal. Like at
Yeah.
some, a woman is no longer gonna make estrogen in their ovaries. So a man at some point, it's just sort of like,
this is what you need.
you know,
So like your pituitary is only going to function like that for so long, and it's already like kind of shut down. So if you have a testosterone level of 200 and your free testosterone is 4, you're never going to make enough testosterone on your own. You are in like testicular failure. So you are never going to make enough testosterone, right? Again,
Yep.
like that's just like going to be you.
and
So it's not like you're shutting your pituitary
Yeah.
down even more. Like it's already
And-
not stimulating your testicles.
and
Like
in
you
a
don't have
and
that.
in a younger patient, maybe someone that's in their 20s or early 30s, and they're sort of considering this. I mean, we could use more natural agents, like checking your DHEA levels. DHEA is a
Pregnenolone.
is a precursor to making testosterone. So again, if your pathways are sort of working and you're of this age and you're doing all the things, yeah, we can really try to stimulate that with a little bit more natural processes. But at some point, our factory is just sort of, it's slowing down, and it's not working as robustly as it once did. And then how do
The benefits compared to the potential risks? We covered this already, Jen.
yeah, I mean, honestly, I think the benefits is that if we most of the time when we are thinking about aging, we want to live a vibrant life. For me, I can speak for myself, and I'm thinking that this is gonna resonate with a lot of people, in that as we're aging, we want to feel good in all of those decades. We want to be able to be running with our grandchildren, or be traveling when we're finally retired, and doing all of the things we want to do. And hormones are a big piece of this. And so think of this as not just, yes, it helps with those acute things of those symptom management and we feel a little bit better, but it's also helping us maintain that vibrancy as we age. I mean, we have men that are in their 70s and beyond, late 70s, that are still using hormone replacement therapy. So, when it's done correctly, when it's done in appropriate dosing, we do get to maintain those benefits from now until who knows when. So I do think that there are huge benefits to hormone replacement therapy.
Agreed.
So listen, everybody, I hope that this was beneficial. I hope that you took something out of this. If you are someone watching and you know that if someone that can benefit from this, please share it with them, because I think that sometimes educated, patients and people, that's what it's important. It's important to know these things before you make those decisions to put anything in your body. And so, Erin, anything to add before we sign off?
Well, I think that your next step would be to book a consultation.
Yes.
And I think tonight, do we have like a
So we do for the first 10 patients that are going to, for our first 10 male patients, it is going to be, Erin, is it $250
I think
off?
that's
So it's
right.
$250 off. So you can reach out to us. Let me just go to the next slide so that you can sort of calculate and get all of our information. But we are here as a resource for you. So if you have any other questions that were not answered, or any other thoughts, etc., please feel free to reach out. We are excited to be part of this community, helping people feel and live vibrant lives. So thank you so much for attending, and stay tuned. Hopefully next month we're gonna plan some other live events as well. So thank you all for tuning in. Have a wonderful evening.
See you soon.
Bye, guys.